Hey guys, welcome to another session on FMT. Today we'll discuss bomb blast injuries, that is injuries which are seen due to bomb blast. At the end of this session, you should be able to describe and discuss blast injuries and the interpretation, describe preservation and dispatch of trace evidence in case of blast injuries. The blast injury is a complex type of physical trauma resulting from direct or indirect exposure to an explosion causing sudden increase or decrease in atmospheric pressure. If the force of explosion is transmitted through the air, it is known as air blast. If it is through the water, it is known as immersion blast. And if it is through the solid, it is known as solid blast. How to classify the injuries seen in blast injuries? So it is categorized into 4 types. The primary injuries are characterized by the absence of any external injuries. Ears are most often affected by the overpressure, followed by the lungs and the hollow organs of the GIT. In primary injury, there is tympanic membrane rupture as well as middle ear disruption. There is blast lung, abdominal perforation, there may be hemorrhage in the abdomen. The secondary injuries result from the flying debris and shrapnel and bomb fragments. Most casualties are due to this, the secondary injuries. Tertiary injury results from individual being thrown by the blast wind against solid objects. The quaternary injuries which do not fall into any of these 3 categories. So diagrammatically you can see this is the primary injury where because of the pressure. Because of pressure we have the primary injury, secondary injury because of the shrapnel and all coming over to the person causing the secondary injuries. And when the person is thrown to any solid object, then we have the tertiary injuries. So what are the types of injuries which are seen? This is a summary. In primary we have the blast wave injury. There is presence of internal injuries and absence of external injuries. So there will be only internal and no external injuries. The body part affected are the gas-filled structures, the middle ear, lungs and the GIT. And the type of injuries that you see is the tympanic membrane rupture, blast lung, abdominal perforation, there may be concussion or the globe rupture or the eye rupture. In secondary injuries, we have the flying debris and the shrapnel injuries and from the bomb fragments. So any body part may be affected. The injuries may be penetrating or blunt injuries and there may be eye penetration. Tertiary is thrown by the blast wind against solid objects. So any body part may be affected and the injuries that you see may be fracture or traumatic amputation and closed or open brain injury. Quaternary injuries not included in any of the above categories. It may include any body part. Injuries that are found on the body are burn injuries, crush injuries and closed and open brain injury. Now there are some of the medico-legal questions which are asked or issues that arise in such injuries. Whether a bomb explosion has caused the injuries. This is a question sometimes frequently asked by the police, whether it's a bomb explosion or something else. Full body photographs and complete X-ray of the whole body are indicated before the clothes are removed. Any radio-opaque fragments or radiolucent material like paper, fragments, wood and plastic may be components of an explosive device. 3D CT, bony reconstruction and even soft tissue injuries from projectiles with foreign bodies in them may help to reconstruct the explosion. Residues are either burned, it may be black or grey in color, or unburned like yellow, brown or greyish in color. This kind of material may be found. Swab the soiled skin and hands. Collect hair and fingernail scrapings. Foreign body, shrapnel or empty shell may be found during the autopsy. Toxicological analysis will be helpful. Extensive burns are usually not caused by localized bomb explosion. Number of dead person. It is a major initial problem. Correct fragments are to be allocated to the right individual. You may have multiple body parts thrown away in different directions. So you have to collect them and you have to allocate them to a particular individual. Identification of the dead. The injuries can be extreme and thus make identification and interpretation difficult. All body parts and clothing are recovered. Clothing is submitted in airtight containers. Dentition, dentures and artificial teeth also help in identification. Fingerprinting, if they are available, they are very helpful. Craniofacial injuries are seen in case of suicide. Lower limb amputation is typical of a standing or seated individual. Hand injuries are seen if explosive device is held in the hands. There may be projectile injury. There is a term called martial triad. It is a combination of abrasion, bruises and punctate laceration. Along with there may be tattooing and soot soiling. So bruises, abrasion, punctate laceration, dust tattooing and black soiling are from explosive materials may be seen. Bruises, abrasion, punctate laceration, which is known as the martial triad, dust tattooing and black soiling from the explosive material may be seen. Injuries may be seen due to fallen rubble. Burns such as flash burns and singed hair may be seen on victims in immediate vicinity. Cause of death? The death may result from variety of causes like complete disintegration of the body, blast shock, burns, blunt force injuries and crush asphyxia. Circumstances of the death need to be looked for. Here you can see in the image, it is a martial triad, somebody asked in your MCQ. Bruising, abrasion, laceration with soot soiling and tattooing. Very characteristic finding in blast injuries. Let's discuss our MCQ. In air blast injury, most common organ affected are, it's easy to answer. The options are A, eardrum, B, stomach, C, lungs and D, liver. So we have just discussed, this is the hollow organs usually which is affected and the most prominent being the tympanic membrane. The answer will be A. Now for some points to remember which will help you in your MCQs. Incendiary bombs primarily cause burns. It contains phosphorus, magnesium and gasoline. Molotov cocktail, it is an incendiary bomb thrown by hand. Blast injury, physical trauma resulting from direct or indirect exposure to an explosion due to the change in atmospheric pressure. If a force of explosion transmits through the air, it is air blast. If through water, it is immersion blast. And if through solid, it is solid blast. Air blast produces compression of the body towards the side of explosion. In immersion blast, body is compressed from all directions. So in air blast, it is towards the side of explosion, but in immersion blast, it is compressed from all directions. In solid blast, force is transmitted through the part of the body in contact with the vibrating solid structure. Blast injuries are divided into 4 types: the primary, secondary, tertiary and quaternary. Primary injury is due to blast wave, presence of internal injuries and absence of external injuries. The secondary injuries is due to flying debris, shrapnel and bomb fragments. Tertiary injury is caused when the person is thrown by the blast wind against solid objects. Quaternary injuries are those which are not included in any of these 3 categories. Most common organs affected by primary injury in order, the first one is they are the ears, the tympanic membrane, followed by lungs and then GIT. Most common cause of death who survives an explosion is a blast lung, in which there is hemorrhage in the lungs, pulmonary contusion, air embolism, thrombosis and DIC. The GIT injury is more common in underwater explosion than in air blast, and colon is most commonly affected. So in underwater explosion, you find the injury to the GIT and the colon is most commonly affected. Martial triad indicates bomb explosion. It consists of triad of bruises, abrasion and punctate laceration, along with some tattooing or soot soiling may be there. I hope you have understood today's session. Thank you.